Slide is showing bilateral dorsal surfaces of the hand as well as of the foot. There is generalized erythema bilaterally present over the hands as well as the foot, and there is scaling, which is also involving all the shown sites. There is a well-defined yellowish crusted plaque which is present over the dorsal surface of the left hand just below the second finger, and all of the nails show are thickened and they show increased curvature as well as yellowish discoloration, giving a appearance of onychogryphosis, which is present in almost all of the nails but is more evident over the toenails. The toes are also swollen, especially the second and third toe. They are swollen as well as erythematous. The palmar surface of the plantar surface of the foot, which also shows some hyperkeratosis. So according to these findings, I would also like to examine the rest of the body, the other foot, for similar lesions, as well as I would like to examine the scalp and especially the extensors like knees and elbows. My first differential is erythroderma, which may be secondary to psoriasis, and second is PRP, and third is pachyonychia congenita. And there is the onychogryphosis is usually a sign of self-neglect, so we cannot ignore that as well.
My task is to provide the differentials, investigations, and treatment of the given picture. As the picture is showing erythema, scaling, and with nail changes, that is the thickened fingernails and onychographic toenails. My differentials according to picture are erythroderma, secondary to psoriasis, pityriasis rubra pilaris, encrusted scabies, and dermatophytosis. So investigations include baseline investigations and diagnostic investigations, and I will do first complete blood count, renal function test, liver function test, serum electrolytes including serum sodium, potassium, serum calcium, serum albumin, serum glucose levels, fasting lipid profile, HIV serology, ECG of the patient, and chest X-ray and ultrasound abdomen. For the diagnosis, I will prescribe the skin scrapings for the scabies mite and KOH mount. And next, that is skin biopsy for the histopathology. And serial biopsies may be required, but biopsy can be helpful in acute cases in about 50% of the patients. And treatment includes conservative management and definitive treatment. As the patient is in erythroderma, so hospitalize the patient and check the vitals and monitor the vitals, and temperature regulation and humidity maintenance, and daily bath in the lukewarm water, strict intake output record. The patient can take oral, then encourage the oral intake, and in which protein diet should be included. In blend emollients, application of the blend emollients to all the part of the body, including liquid paraffin and white salt paraffin, and strict RBS monitoring. And if there is any evidence of skin infection, then it will be treated accordingly. Anything that has been occurring during this phase should be addressed and should be treated accordingly. And the definitive treatment depends upon the underlying cause, which will be diagnosed after the proper investigations and full whole body examination. And as the nails are hypertrophic and onychographic, so the treatment for this, management for this includes appropriate advice for the appropriate footwear, and palliative treatment of the nails, including regular paring and trimming of the affected nails, usually by the podiatrist using the nail clippers and filing and mechanical burr. Thank you.